Good afternoon, everybody. Welcome to our private well class webinar for May, which is on what environmental health professionals need to know about wells. We're at the Illinois State Water Survey at the U of I. We manage the private well class, and our partners in this work are the Rural Community Assistance Partnership, which sponsor, fund, and help support this program, as well as regional funding from US EPA. Through their Technical Assistance and Training Grant Program. So about today's webinar, it's part of this national program we have with RCAP. We're kind of the online side of things. They have staff in every state. They do the boots on the ground work. There's 6 regions. I'll show you a slide in a minute. And each of those regions have folks that I work with and that work directly with well owners in person or with professionals who want to put on, classes or workshops, things like that. And it's all funded by US EPA, so it's all free. And it's actually a really valuable tool. It's grown into a really valuable tool to support teaching well owners about why they need to be a good steward of their well and their aquifer, all those sorts of things. We record all of these. They're available on our webinar page. First part is upcoming webinars. The second part is past webinars, and on our YouTube channel. You are all given a chance to ask questions when you register, but if you have a question that comes up during our time today, you can put that in the question box or chat box. Katie will be monitoring that and making a list of those questions, and we'll bring them up at the end. And so, and it should also mention that our 10-lesson class that I'll talk about later is also available on the National Environmental Health Association's website, and I'll go over that more later. But they're also a partner in this program, and we're an licensed CE provider for NEHA and for Illinois, which I probably is on my next slide. Yeah, so the NEHA guidelines for CEs, if you are a environmental health professional, are a 2-year credentialing cycle. So if your credentialing cycle just started in May 1st this year, and you take this class today, you won't be eligible to take it again until after May 1st of 26. And so down the bottom right, I show the dates that we provided this webinar with. The core content's the same. Not every slide is identical, and the questions certainly can be different each time that we answer. And so, but that's the way this all works. And so our email address, info@privatewellclass.org. You can reach out to us. I believe there are handouts available too under your handouts tab, and then we can provide other things that you need. And I know that at least one state allows their drillers to take our classes or do these webinars for credit. And so if you need a copy of the slide deck or anything else, just let us know. Excuse me. Okay, so RCAP, I mentioned earlier, the Rural Community Assistance Partnership. It's made up of 6 nonprofit organizations that each work independently, but together they're a network or a partnership, if you will, with a national office in DC. All of their funding at the national level comes from either USDA or US EPA, at least related to wells. And so most of the regions, for instance, offer the low interest loan program through the Farm Bill that USDA manages. And so there's someone you can talk to if it's for low income folks that may have a well or a pump or a septic problem, things like that. Each region has a lead just for the private well program. And so I work with those folks. We have a kind of a work group to talk through things. We try to standardize what's going on around the country so that we're giving well owners the same information, because that's a really big problem locally. A lot of times someone will be giving bad advice, and that just causes more problems than it does good. They also can work with you if you're a local health department or health district or a state and you're interested, or extension, or even a driller that might want to put on an event for their customers. RCAP folks, we can certainly get you in contact with them in your state, and they'd be willing to work with you to do those things. So they're speaking at events like the State Environmental Health Association, state drillers meetings, other events like that, or groundwater meetings that are put on like through extension in some states. So we're at the State Water Survey. We've been around for 129 years now. We're a sister agency to our State Geological Survey and Natural History Survey, which more people are familiar with around the country. Illinois is one of only 2 states that has a water survey. And it was really started because of cholera and typhoid outbreaks. So the first job they had, Arthur Palmer, was to sample community water supplies in 1895 and 6. And so it's since then that we've grown into an agency or an organization that does applied research, education, and outreach. I'm just going to show a couple pictures from our files because that's another thing that I do around here is we found all these glass plate slides that date back to 1900 and we're trying to preserve them all. They're really cool. This is from our well logs. We're also the repository for well logs for the state of Illinois. And so we have about 450,000 or so paper records for the about 800,000 wells that we think exist in Illinois. And that's actually pretty good. Many states have much fewer percentage, a much lower percentage. This is one that one of our staff ran across. It's cool because it's a 135-foot hand-dug well. If you know much about wells, you know, I grew up on a hand-dug well that was only 14 foot deep. My grandpa hand-dug it in 1933. This one's 135 feet deep. I can't imagine someone going down a 5-foot hole that far and you know, everyone coming out okay. So they use 2 buckets in a chain. You know, this is from I think it shows it here from 1934, but it said it's 60 years old. So the well was actually hand dug in the 1800s. And what's cool is the water's at 60 feet, which another question I have is how did they get 135 foot if the water level is that high? Anyway, pretty interesting. There's a lot of neat stuff in our files. So again, I'm Steve Wilson. I'm a groundwater hydrologist here at the Water Survey. With me today is Katie Buckley, who's also in our group and will be fielding the questions. She also put a lot of the stuff together, the logistics for this webinar. And Sally Dolan is our Senior Scientific Specialist in Environmental Health. She's an EHP. She worked at a county health department, so she actually has environmental health chops that Katie and I don't, which is great to have on board. And she helped with the questions, some of the questions we're going to answer today. So with that, we need to do a poll question first. We like to know who you are as far as what, if you're in this because you're a well owner, or are you a regulator, or you know, are you with a public health person or a driller or whatever. So Katie's going to open a poll. I guess it is open.
I've opened the poll. We just want to know what role best describes you today as a participant on our webinar. So just select the response that best describes you. I do realize that you may fall into one or more categories, but we just want to collect some information so that we know who is attending our webinars. I'll leave it up for a few seconds.
Yeah, and you know, this webinar is meant for EHPs per se, so we don't expect to have a lot of well owners, but there always are some, which is great. Yeah.
All right, we have 80% of our participants have voted.
Yeah, and it looks like we have 11% say other stakeholders. For any of you, if you don't mind, putting in the chat what your role actually is or what kind of stakeholder you are. Just curious. It's just for my benefit, no other reason. Yeah, cool. Thank you.
I'm going to go ahead and close the poll, share the answers quickly, and then I'll toss it back over to you, Steve. It looks like, yeah, majority of folks are private well professionals or some sort of regulatory agency or other stakeholder, which is great, which is what we intended. All right, I'm going to hide the poll, and then it's back to you, Steve.
Okay. Okay. So today we're going to talk about, this is our list for today, challenges and issues that we all face. You know, as professionals working with well owners, you see a lot of different things, good and bad, as well as, you know, well owners are quite a group of people. You know, there's 23 million private wells in the country. That's 58 million people. And they really come from every walk of life, from really wealthy to really poor to rural to urban. They really represent almost every demographic, which makes it really hard, or much harder, to do outreach. It's not like we're out trying to just reach farmers or some other demographic. And so anyway, that's a important consideration whenever you're trying to work with those folks, is understanding who your local group might entail. We're going to do a little bit about groundwater and wells, just kind of an overview of the basic well types and some of that information. And then I want to talk about the gap between groundwater and health professionals, because I'm a groundwater professional, but I work in the public health space. And so there's many great people I've worked with, but I've also ran into a few who basically think that because I am not a health professional, that I don't rate, and that's fine. And in some cases, I'm sure I don't. But anyway, I think there's a lot we can learn from each other, and that's the message today. And then we'll talk about our private well class program and some things that we've been doing. We just launched a new help center. I'll show that too, and then we'll get to your questions at the end. So there are lots of issues when it comes to protecting how wells affect us, right? Public health protection, source water protection, abandoned wells are a culprit there, and just general water quality. It may be natural occurring water quality or from man-made sources, but those are really the things that we're really dealing with in this space. There are a lot of issues in the news, drought, flooding, Flint, Michigan, PFAS today, and lead. All of these things are an opportunity because, for instance, we've had a number of operators, water operators for small communities tell me that whenever they have a main break and they put it in the paper or on the radio that, hey, you have to boil your water, they get calls from well owners who live outside of town wondering if it's going to affect their well. And, that's just the well owner not understanding the difference between a community water supply and their private water supply from their well. They're not related at all. There's no risk there, all that sort of stuff, which is why I have that listed there. But anytime something does happen, it's usually a really good opportunity to do outreach and to help inform people. And a lot of times well owners, that's when they're going to have the most interest in learning about how to take care of their well or what things they need to be concerned about and those sorts of things. The challenges, though, we have are that wells aren't regulated like community water supplies are, right? Public water supplies have to meet the Safe Drinking Water Act. So there's a set of standards nationally that every public water supply has to meet regarding water quality. But for private wells, there is no such law. And so you have different things in different states. Even the definition of what is a private well in some states can be different. How they're permitted in each state, how they submit well logs. New York didn't require well logs until 2000, where Illinois it was 1968. And so the difference in the number of wells that are actually on file in each of those states is very different. I mentioned New Jersey because they're proactive. They passed a law nearly 20 years ago that requires testing at property transfer. Now they use multiple labs, but when it started, their state lab did the analysis. It cost $600, and the results only went to the buyer and the seller, and they had to decide among the two of them who was going to pay for it or how they were going to get that paid. But it gave the state a ton of really great data to understand natural occurring contaminants, where there were hot spots from other things, maybe man-made sources, all that sort of stuff. And they still do that today. On the other end is Pennsylvania, which still has not passed a law requiring a well construction code or licensing drillers. And I say licensing drillers, I'll show you a slide next. Drillers in most states, all the other 48, the other state that doesn't is Alaska, but they actually are working on it. They're being very proactive among their state and local folks to get some stuff done in Alaska so that there is code. But in Pennsylvania, anyone can drill a well if they pay a fee. And there's no continuing education credit for drillers. They don't have to pass a test, which in all the other states you do. And so, that's here or there. It's just, the state legislature basically has really let the citizens of Pennsylvania down, in my opinion, by not developing some of those things to ensure that wells are installed properly. They're not going to contaminate an aquifer, all those sorts of things. And then when it comes to enforcement, every state certainly is not created equal as far as the money they have in either their health department or whatever agency is regulating well construction and drillers. Some don't have the funds to go out and inspect wells when they're drilled, or to sample at construction, which some states do. And so, it's not, because they're not regulated, a lot of times it falls through the cracks in that respect, especially like at the county level or the local health district level. When you have septic inspections and, restaurant inspections and all the other things that are required, private wells become, either you find someone who happens to work at that health department who's really interested in it and willing to take it on, or they find funding somewhere to do some of that work, but it's sporadic. They may have a project for 3 years and then that's the end of it, or whatever. So what happens then is nationally, like where we sit and look at all the stuff going on around the country, it's very unorganized. There's local approaches in some cases, in some places there's nothing. We went and gave a talk for at a county in Indiana, and a bunch of residents came, and somebody from the state health department came, and one of the well owners who was there said, well, where's our county health department person? And they told the truth. They invited them and they chose not to come. They just weren't interested. And so, that's the only time that's ever happened in all the places that I've been and all the work and talks that I've given. But it stuck with me, obviously, because it's, but you find that in every industry and all that sort of stuff. So it's, you just don't know what you're going to get, is I guess the point here. And so we hope that we're creating some materials and information that kind of standardize things that everyone can go to then and kind of learn some of the basics that way. So I mentioned Pennsylvania, so I just highlighted this. When I gave this presentation one other time, someone put in the chat, oh yes, we do license drillers. Well, you can buy a license, but it does not imply that the driller has knowledge of proper drilling or well construction practice. There's no statewide construction or siting standards. It's ultimately across the state, it's the responsibility of the homeowner. So everybody on this call today could get a license to be a water well driller in Pennsylvania if you're interested, which, and there's no testing, there's no continuing education, all those sorts of things. So that what I found, and I've worked here over 30 years. I worked with well owners for almost all of that time. These are the two biggest problems we have, is old wells. I'm showing 2 old wells here, and just a lack of well owner knowledge and education about how to take care of their well basics, what it means to have a dug well versus, a drilled standing gravel or bedrock well, all those things. My dad was that way. Our well was only 14 foot deep. It was actually at the base of a ravine, so water could run from both sides towards this ravine, surface water. And what I learned later in life is that our well was always contaminated. It always had bacteria in it. And I just didn't realize it because I was used to it. So when I went away to college, I came back after drinking water that was chlorinated from our community. I lost bacteria in my stomach, and when I drank our water at home, it made me sick. And that's just the way it is, right? And so a lot of people say, well, I've never gotten sick. Well, somebody comes to your house that's not used to that water. If it's contaminated, if it has bacteria in it, they're going to get sick in all likelihood. So, and poor construction, the way all the well construction codes have been written is everything that's already there is grandfathered in. So just like the well I grew up on was installed in 1933, we do not have a record for it here at the Water Survey. It's the same in every state, or when well construction code changes in a state, no one has to go back and redo their well to make it meet the new code. And so that has caused a lot of problems with contamination, because the one on the bottom here, that brick was out. we went there to measure, to take a water sample of this, and it was a renter, and that was their well, and there was a toad floating in their water. It's just, you can't make those things up, and it's just a shame when all that happens. And they were basically from the city and were renting a house out in the country, and just no idea that that was an issue. And as I mentioned, they come from every social, economic, and education class. Again, some have been on a well their entire life, several generations, and some may be from a community and had community water the whole life, decide they want to buy a house out in the country and try it that way for a while. And I say very rural versus where I grew up, versus Cook County, which, if you're familiar with the Chicago area, it covers parts of about 11 counties in Illinois, but the core middle county along the lake that is Chicago is Cook County. So it's completely urban, and there's almost 3,000 wells in Cook County, private wells, which when I tell people that from Illinois, they are really surprised, but it's a fact. And so, they have very different problems. We had to worry about livestock or those sorts of things, or an ice storm. We lost power for 7 days, where the folks up there have to worry about, if their wells, it's in an urban setting like that, you have road salt, you have other contaminants, a lot of urban type problems that you don't have in other places. So Barb Luukkonen and several others did this study where they sent out almost 2,700 questionnaires to folks in 2 counties in each of Minnesota, Wisconsin, and Michigan. And what they got back was that basically, and they offered, some people they put in a $2 bill, some people they put in a coupon for a free water test, and then some they did both. And you can see the difference. When you have incentives, that's part of the research they were doing, was to look at how that might affect return rate. It obviously made a difference. And actually, we had Barb speak at her first private well conference in 2017, and she said she was shocked at how many people sent back the $2 bill and said, "Oh, we don't need this, thank you," blah, 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 which is, good to hear. But one of the things on the bottom left, really 87% of people who had not tested their well were only slightly or not worried at all about their well water. And obviously those folks are from a range of, have a range of knowledge about their well. Some may know a lot about their well, some probably don't know anything about their well. And then they gave them a laundry list of about 20 reasons they hadn't tested, and they could check any one of them they wanted. So, it doesn't add up to 100. Half said, "We've been drinking it for years." Didn't know to test, didn't know how to test. It's probably fine. 8% said, "I don't want to know." You have this problem with your tooth. You don't want to go to the dentist. It's one, going to hurt, two, it's going to cost you a lot. Same principle applies here. It's probably fine, so I don't want to know what's in it, because then I might have to add treatment or not be able to drink it, and that's, and so actually had that happen to me when we were sampling. We do a lot of research here too. We were sampling homes for arsenic, or wells for arsenic, and I had a gentleman tell me, "You can sample my water as long as you do it, I'm not home, and you don't send me the results." Like, okay. And what it ended up being, he was selling his home. And in Illinois, there's a form you have to fill out that's legally binding. And one of the questions is, do you know anything adverse about your well or your septic? And he wanted to honestly be able to say he knew nothing about that. And so that's what happened. You can't make those things up. So there's reasons I didn't know what to test for. I didn't know how to test, didn't know I should test. Those, I highlight those because that's where, overall in our ecosystem, if you will, we're not doing enough to get the message out to people, and it's hard. Some people don't want you to bother them. Some people, it's a very diverse group, as I mentioned, but these are the things that we can deal with, and what we try to deal with our program is making sure that people have that basic information. The other, it's probably fine, I don't want to know. We have a whole list here of different categories these fit in, but again, they're really hard to reach. One, they just believe it's safe because it's groundwater. Can't see it, it's in the ground, ground's a natural filter, right? So all those sorts of things, I mentioned human nature, cost or perceived cost. Just really, some people, just they're independent. They don't trust the government. They don't want anyone knowing what their water quality is. I was working with a researcher who was using samples in Canada. They have a program there to pay for samples. And I said to the guy, I said, well, what about all the people who don't want the state to have their results? He hadn't even considered that his whole sample set was biased. And so I ended up calling 3 labs in Canada and asking them, I said, I gave them this whole spiel and just said, I don't need a number. Do you have more or less people who ask for a water sample? They pay for it themselves so they can keep it private. And 2 of the labs said yes. The other one said it's probably about 50-50. And so, people just don't want to share that information. There's a risk, right? If you sell your home and you have bad water quality, what I say to those folks is it's better to sample and know it's there and mitigate it. Add treatment if you need to so your water is safe. It makes you look better, makes you proactive, and it also then you can disclose all that without any concern to a potential home buyer. So I'm going to talk about a little bit of aquifers and wells. There's really 3 types here. A dug or bored well is a large diameter. It's like a cistern. It's just a large vessel, if you will, usually at least 3 foot diameter. We've seen them as wide as 20 feet, hand dug, 20 foot well, 20 foot diameter well. They're either really old because that's all they knew, like there is a sand and gravel aquifer on the property I grew up on, but it's at 80 feet. My grandpa bought it and put it in a well because that's what he did. But then you have either the drilled or driven wells in sand and gravel. And that's, when you have sand and gravel, you use a well screen for the water to come in, or in consolidated rock or bedrock. That's the 3rd type. And a bedrock well typically only has casing part of the way. Once you get into fairly solid rock, you don't put a casing. The hole you drill through the rock acts as the casing because you're trying to hit fractures. And I'll show an example of that. And in some cases there may be choices. Here in Champaign County, Illinois, where we live, we have at least 2 sand and gravel aquifers before you hit bedrock. Hardly anyone drills a well into bedrock, but you could. There's also a bedrock aquifer here. But knowing those differences, knowing what your opportunities are, for instance, there's a bedrock aquifer in Wisconsin that's super high in arsenic. And so they actually passed a law that they've legislated that you can't use that particular unit. And so if a driller wants to drill past it lower to get to another freshwater aquifer, he has to case it all the way down through that. So there's no chance of that high arsenic water getting in the well. But most people just don't go that deep because of that. So a large diameter bored well, you can see the 2 gentlemen on the rig and that big circle there, and that's called a bucket rig. It takes out, it augers down and then pulls out the dirt. You can see the hole underneath those 2 guys on the ground. So that's usually a 3.5 or maybe 4 foot hole, and they use a 3 foot diameter concrete tile. So it's like the concrete tile that goes under a road but put vertically. And then those are 4 foot sections, and the water can seep in through those openings. You don't cement it, they're just sitting on each other. And so that allows water to seep in because of water pressure on the outside. And so that's a typical construction. They make them out of some other things these days in some cases, but it's not widespread. These are all dug and bored wells. And I'll show you that. The top one is an old hand dug well. This is a cattle pasture. The reason those posts look so worn and rickety is because that's where the cows come and scratch. And so they're probably doing other things there too. It's shallow. You can see how muddy it is there because the cows have been around it. And, a lot of things can get in this well, including snakes, rats. It's just got 2x10s covering it with, some concrete blocks and tin sheeting. So that's, the well I grew up on was actually in a little building, but inside, like the insulation was always falling all over and falling into the well and stuff like that. It's just not a good situation. Really, all old hand dug wells, almost all of them, probably need to be replaced. And that's just not something that people do, especially folks who've grown up and had that well and think their well water is the best tasting thing since sliced bread. Then the other two, the one on the right is the concrete tile construction I mentioned earlier, and it's just got a concrete lid. All the piping's inside, probably the pump as well, depending on how deep it is. And you know, at 3 foot or so below land surface, the pipe turns horizontal and goes to the house. And then the bottom one looks like a drilled well. This looks like a 6-inch steel casing. That is actually also a large diameter well. It's just that concrete pad you see on the right has a hole in it, and it's down at 10 feet. And the reason that construction is actually considered more favorable is because then you can fill the borehole you've created, that big 3.5-foot borehole, with clay or even cement material, such that it's much less likely for surface water to get down into the well. Whereas the other two, the concrete well on the right, if it's not cemented on the outside, then the first seam, if that's 6 inches above or a foot above land surface, the first seam is at 3 feet below land surface. And so water can get in as shallow as 3 feet into that well, and that's not a good thing. Heavy rain or ponding water, anything in the yard, if there's a farm field nearby, whatever, or livestock or whatever it might be, that water's usually not potable. So here's the two constructions I just mentioned. The one on the left is where the casing goes to the top. You don't see, this is an old diagram. You use it because it's got both on it. We've made a new one. I just haven't put it in here, I guess. Because the casing doesn't, or the drop pipe doesn't, from the pump, doesn't go all the way up through the top of the middle of the well. Now it turns down at 3 or 4 feet so that you don't have those issues with freezing in the winter if you're like the one on the right shows. And so then the one on the right, they said clean earth fill here, but it could be cement as well. Just material it's slow to infiltrate, so that water runs away instead of running down into the ground. So, but these are two typical constructions, and in each of those seams, you can see where the pieces of concrete tile fit on each other. There's a male end and a female end, and they just kind of sit on each other without actually being cemented together or being watertight. So sand and gravel wells, I mentioned, have a screen. This is a well screen. And, I think one of my favorite things to do when we go to the state fair is to show a screen on a door and ask the kids that come by, what does this do? It does two things. One, it lets the air in. What's the other one? Well, it keeps the bugs out. This lets the water in and keeps the sand and other material out. So you size your well screen, which means the space between those woven rings of stainless steel, those are all a certain slot size or number of millimeters based on the size of the sand or gravel grains where the screen goes in the ground. So when a driller's drilling a well, he's collecting samples as they drill, and he's writing down, in theory, a well log that says, coarse sand from 100 to 120, where at 80 feet it was fine sand. So you're going to go down into the coarse sand to put your well in, because you don't have to worry about those fines getting in your well. Because fine sand, it's like use sandblasting to get paint off. Well, that sand over time, messes with the seals in your pump. It can scour pipe, all sorts of things. So it's important to size the screen so that none of that happens. Most of the time, the casing itself. So in this case, the well screen's only at the bottom. So you finish the well, say it's 100, let's just say it's 200 feet deep. The bottom 4 or 6 feet for a private well is going to have a screen. The rest of it's going to be solid pipe. It's going to be PVC or steel, depending on where you're at and the regs and how that driller may like to do things or cost. There's really, one's not necessarily better than the other. PVC is cheaper, but they both work. There's many of both all over the country. So this is a well log for a sand and gravel well from Illinois. You can see I'll start at the bottom right, that's the geologic material that they pass through. So there's 2 foot of topsoil and then 12 feet of clay, brown clay and gray clay. So brown clay means it's got air, and gray clay means it's underwater most of the time. So the water table is at 14 feet, which is not the aquifer, it's just the water table. It's where the geologic material is saturated, first place it's saturated. So then there's clay all the way to 120 feet, and then they hit sand and gravel, and then more clay, and then when he says tight sand, that's usually fine. And then it's, when you think about a river that's dropping sand or gravel, whatever, is it, when the water's high, it's got more momentum, the biggest particles fall out first, and then the finer ones fall out last when it's going slower. And so that's how aquifers are formed. Especially sand and gravel aquifers were formed from melting glaciers most of the time, or they're in river valleys where, the same issue. And so you see usually the coarser materials further down. In this case, he went to 295. And if you go up to number 22, they used, it looks like they used steel here. I think that's what SDR 21 and 17 are. So they used steel down to 291 and then put a 5 foot of screen, or 4 foot of screen from 291 to 295. What that means though is that it's solid pipe all the way to probably a foot above land surface or more. The only place water can get in this well is from 291, 295 feet below land surface. That is great as long as the outside of the well, which, the borehole's bigger. If you're putting in a 5-inch private well, you're probably putting in a 6 3/8 hole, or might be bigger, a little bit bigger than that. So the space outside of the casing, once you put it in, has to be filled. And most states require either cement or a clay grout, a liquid grout that'll seal so that things can't run down from the surface along the outside of the well. And so as long as the well is properly sealed, it's very unlikely that anything from the surface would ever get into this well, as long as it's properly built. So that's a good thing, right? And they also provided this just as a diagram. I think they have some software probably, but this is what they provided in their well log when they sent it to the county, and then it comes to us. So the difference here and then is a bedrock well. Typically, water doesn't flow through bedrock. It flows through the cracks and fissures in the rock. And I did say here, possibly from the rock itself. If it's sandstone, it can have some porosity in it, but most of the time you're in limestone or even granite in some places where water's not moving through the rock itself. It's actually moving just through the cracks and fissures. So it's like pipe flow, and you have to find those fractures to get water. If you hit no fractures, you may get 1 or 2 gallons a minute or none. Where if you hit some very big fractures, you may be able to pump, several hundred gallons a minute or more. But what that means is when you drill a bedrock well, you usually only have casing for the first 10 or 20 feet, like it shows on the diagram. So steel casing, 10 to 20 feet of casing into bedrock. After that, it's just it's the hole you drilled in the rock, and you're hoping to hit those little lines where those fractures are. So right down by the pump, you can see there's 2 fracture lines that go through there. So that's where all the water's coming from in that well. And it may only be 1 fracture that you hit. Hopefully you've hit a bunch, but depending on how fractured the rock itself is, dolomite and limestone are more fractured typically, dolomite anyway, than like granite is very not fractured. It's very solid, and it's so a lot of times you see very low producing wells when you have to put a well into granite. But that also means that 1 fracture, it really depends on how big it is and where it goes. It could go back up towards the surface, and if it does, then you're getting water from a pretty shallow spot. So the same 200-foot well that we talked about for the sand and gravel well, where you're only it's only the bottom 5 feet where water's coming in through the screen. Here, you could have a 200-foot well, but if bedrock's at 30 feet, you maybe have casing to 50 feet total, and then the other 150 feet is all open to any fractures you might hit. So bedrock wells are open to a larger unit of the aquifer or the geology, and because of that, they can be both influenced over larger distances, and if it's just 1 or 2 fractures, it could be that the chance of contamination could go up. Not necessarily, but it depends on, what's at the surface. Like in this example, we have the overburden is really just the sand, gravel, clay, silt, that it's all mixed up. If it's from a glacier, it's called glacial till, and a lot of times it's not very, it acts as, water runs off instead of through. So, and here's a bedrock well that shows that example. If you look at the casing aligner, number 15, they have black steel. So here they use PVC, except for the bottom 20 feet. And then they use steel. And that's because when they seat that into the bedrock, they could break, it's easier to break the PVC, right? So if you're trying to, it's something I haven't done, but it's the way you seat it in the rock, it's you have to use some torque. And so that's why they did that. And then the PVC is there just because it's cheaper than using all steel. But then when you look at the geology, it went to 199, the casing did, and it stopped, but the hole goes to 260. And so, they found a hit limestone, broken limestone for a few feet, and then it's solid limestone from 189 down to 257. That's the fractures they hit in that limestone is where the water's coming from. And so, so there's, 60 feet of open hole in this well. So we talked about old wells. We still see wells with the old piston pumps. They're still down in, they're below grade. They're in a pit. Couldn't think of the word pit, and it's right in front of me. Because in the old days, before there was, when they first started installing these wells, they put wells down in a pit so that it would be below the frost line, so they didn't have to worry about their pipes freezing. And then around 1960, folks started using pitless adapters, or a pitless unit, which allows you to uncouple the drop pipe down to the pump from the pipe going in the house, and you put an elbow there so that it stays. You actually just go out underground the 3 or 4 feet you need to be until you get to the house. And so that eliminated the need for a pit. And so now wells can come up to the top, and you still have, so you can open it. If your pump is actually a submersible pump in the well, you can pull it. All those things that it's just an advantage. And so we still see wells in pits, and we still see hand dug wells that are just getting shallow water from the water table, that if, depending on the type of geology, could be very contaminated. So they're not only are they a contamination hazard, but they're also a safety hazard. In Washington State, it's the Department of Ecology that licenses drillers and manages their well construction program. And these are pictures. The top two are pictures from, well, the one on the upper left is from Washington State. They have a blog, and this well is in a well house. It's corrugated pipe. There was a piece of plywood over it. You can see the pump sitting there, and a woman who owned that stepped on that and it broke. She fell and it killed her. And that's not, it happens. I mean, it's not a totally uncommon thing. And the one on the left is a dead goat. Don Kelderman was researching his family history in Southern Illinois. We happened to be staying at the same place. He was showing me these pictures, and you could see the old stones down at the bottom where they put a piece of concrete tile, so it's up above land surface, but it wasn't covered, and it wasn't high enough to prevent that goat from wanting to get some water and get in there. And the one on the bottom I already showed you and told you that story. Okay, so what should you do? Obviously there are programs for abandoning old wells, and there's also, if you have a well that's in use, you can encourage the homeowner to bring it up to code if it's possible. Especially a well in a pit, you can just extend the pipe so it's above grade, put in a pitless, and I realize none of that's cheap, but it's much safer, especially a well in a pit. If you have a heavy rainstorm, typically, even if you have the right kind of well cap, after a few years, the gasket that's in there that is supposed to make that watertight, those get old, they have to be replaced. And I don't know anyone who replaces a gasket on a well head. regularly. And so once that gasket isn't working like it should, then any kind of overtopping of the well is likely to cause contamination in the well. So yeah, that's just, and you can talk to, if you're a well owner, your local well authority or driller or contractor or your county extension, a lot of folks have some knowledge and can help you. And you can always call us too. So the other thing is abandoned wells. Because well logs weren't required to be filed until the 60s or later, I mentioned New York, there are many wells that aren't on file. The state or a county or a local health district don't know where all their wells are in a given area, local area. And so because of that, someone buys an old farmhouse, they realize they wanted the property, they're going to build a new house, or later on they build a house behind that one for a son or daughter, those sorts of things. Maybe they put in a new well and they're just like, well, we'll just leave the old well in case we want to use it for the garden or something. And that's very common. You forget about that. It's an old dug well that's got a, you stick a piece of plywood over the top of it or a piece of metal. It's really a risk. And, if you have one of those, I mention this every time, it's really important to abandon it, not only because of the safety risk if someone gets hurt, but also because it can contaminate an aquifer. And if, depending on the direction of groundwater flow, we see where people take see that big hole in the ground and think, oh, that's a good place to dump stuff. You see it with old wells, and you also see it in karst where there's sinkholes. People start throwing all their trash down the sinkhole, not realizing that that's the aquifer that everybody's using for their drinking water supply. Some more examples. Both of these pictures are also from Washington State Department of Ecology. In one, they're pulling a horse out of a well, and the other one in Sheldon, Washington, this guy fell 45 feet and he walked away. Super lucky. He was out in his backyard. He had no idea there was a well there, and he fell through. And yeah, somebody found him, and they were able to get him out. We just had that happen here. A colleague and I went down to investigate this woman, said she had a small hole in her yard. And so we went, and we have a camera. We were going to put it down and see how deep it went and all that stuff. But it was pretty easy to lay there and with a flashlight and realize we were laying over, somehow there'd been just enough dirt or whatever to cover that up. But there was an open hole, old dug well right in the middle of her front yard. And she drove a riding lawnmower over it. And she's just super lucky that she didn't go down in there. So yeah, they need to be abandoned so things like that can't happen. All these newspaper clippings are from the 90s. The third one, Jessica McClure, she was 18-month-old. If you're old enough to remember that, it was covered live on CNN. It was like, I don't know, it took 24 hours or something to get her out of there. But she survived, they got her out. Now she's a mother 3 today. So groundwater and health gaps. Groundwater is complicated. Multiple aquifers. I mentioned here in Champaign County, there's 3 different aquifers that you could drill into. Each has its own chemistry based on the geologic materials that formed it. So they're different glaciations, like for the 2 sand and gravel aquifers, from different time periods, may have been several 100,000 years apart. So where the sand came from is different. And so it can have different chemistry. We see in one of our major sand and gravel aquifers, there's 2 bedrock valleys that are full of sand, and one of them came from the west or from the east, and one came from the north. When you drill in the area that's called the confluence of those 2, you can tell exactly which one you're drilling into, because one has red and black grains in it, and the other one has a pinkish and it's finer tinge to it. And it's just, they came from different sources. So yeah, all that matters is my point. And well water issues aren't straightforward. I mentioned Johns Hopkins because they put out some information. I was helping with a work group trying to develop a strategic plan for CDC for private wells. And they pulled a list off EPA's website of all the problems with community water supplies, and included algal blooms, which is a real problem for a surface water supply. But algae require sunlight, and you don't find algal blooms or algae in a private well. And so I always remembered that, because it's like, well, yeah. So they're not community water supplies is the bottom line. They can be very different. There's two different kinds of samples here, because you're running everything through pipes. You may run it through some kind of treatment, but a groundwater sample versus a drinking water sample can be very different. In fact, our lab here used to do sampling for inorganics and metals for any well owner in Illinois for free. So we had them collect two samples, one from an outside spigot that never went through the house or any of the house plumbing, or maybe one right by the well, and you let it run for 20 or 30 minutes so you know the pump's kicked on and you're actually getting groundwater, and then one from their kitchen tap, which is their drinking water, and they can be super different. If you have a softener, filter, or because of your pipes, you can pick up lead or copper and some of those things. So understanding the difference in those, dealing with well construction issues, they can just be very different depending on what kind of casing you use, or what kind of polymers they use when they drill the well can affect things sometimes. So, and we have no information on treatment or bottled water use. There's no way to know if you're going to do a health study with folks on private wells. You basically have to gather a ton of information. You just can't go off the water sample, because you don't know if they're even drinking it. If you're going to put them in a cohort with folks, maybe you have a higher cancer incidence in one area and you want to investigate if it's private wells that could be contributing, you have to know everything about all those private well owners, including whether they have any treatment on their system or if they're actually drinking it or using bottled water. A lot of people tell us that they're not drinking their well water. And my answer to them is, why? Did you test it? And many times, no. They just choose to drink bottled water instead, which is just a waste of money, in my opinion. So we have a lot we can learn from each other. There's a lot of, some of your team should have both. And yeah, Lagoon example, I put that here because, I've been doing this work for over 30 years. And we put a work group together to develop this assessment tool to, it's kind of like a sanitary survey for a private well, which is, a vulnerability assessment. What might be wrong? Is the cap on tight? Is it high enough? Is it in a low spot where it could flood? Are they storing chemicals? Is their dog tied to it? Is it too close to the barn where there's livestock? All those things. And we were developing this, looking at what kind of wastewater treatment homes may have, a septic system or whatever. And someone brought up lagoons, and I was like, people have lagoons for their on-site wastewater, and it turns out Illinois allows lagoons. So do a number of other states. And I know one of the people in our work group was a county health department lead in Tazewell County, and she said, we have a lagoon. We have a person with a lagoon for their wastewater, which so we can all learn. That's my point. Long-winded, sorry. And I mentioned geology is complicated, so I spent a lot of my career working in the Muhammad Aquifer. It's in a bedrock valley, which before there was any glaciation, rivers were formed and cut into the bedrock. So like the Grand Canyon is where water cut through the Colorado River, I think. And so, but anyway, those big bedrock valleys here in Illinois, for instance, they were filled with sand and gravel whenever the glaciers came through. We've had 3 sets of glaciation here. And so you can see you can just see how complicated it is. The yellow at the bottom is the Muhammad sand and gravel. It sits on top of bedrock. Then there's some till and some thin sand lenses. That's where glaciers receded or went forward or started melting. And then this is over thousands and thousands of years. And then you have another glaciation later that put a new soil layer on top. And anyway, there's 3 sets here. And if you drill a well where I put the red bar or the red arrow, you're hitting 1, 2, 3, 4, 5 different aquifers, or the edge of at least. And any one of those, a driller can say, oh, this is a really good sand. I'm gonna put the screen here. And so you just don't know. And most of those have different chemistry, not markedly different per se. It just depends. But like we know, the sand over here on the eastern part of the Muhammad Aquifer has much less arsenopyrite in it, and because of the chemistry, also much less arsenic in the well water in the deeper aquifer. But the shallower one, which is called the Glassford, just south of Champaign, we see arsenic at, the standard is 10 for a community water supply. We see arsenic over 150 to 200 in some homes, some wells. So the chemistry is a little different, and it's just how it is. So the best thing to do is to develop a relationship with your scientific surveys, which in most states that's the State Geological Survey or the USGS. In Illinois, we have a water survey, as well as all the other resource agencies, the DEQs, DNRs. I know Michigan was a DEQ and now they're Eagle, but whatever they go by. They're the one who maybe have maps of the geology or of known water quality or those sorts of things, or where they know their sources. Like in Illinois, that's our state EPA, and we go by Illinois EPA. Some states, it's the Department of Health that has primacy, where they're regulating all the public water supplies. They typically are also the same agency that knows where all the underground storage tanks are and Superfund sites, and where there's any kind of remediation type work going on. Those are important to understand and know if there are any in a given area, right? They also map aquifers, so like we do, we collect water quality information on basic groundwater as well as from homes. And we also, then we can even model using computer models, like to help communities understand how big their resource is and how much water they can get and things like that. But we tell well owners, you need to call all those people and know who they are. If you ask good questions, they're going to be super willing to help you. And that's, we try to tell well owners, you should take our class first, the 10-lesson class, and get a good understanding of the basics of being a well owner, because it will help you ask better questions, either when you have a problem or when you want to learn more. And so that's kind of where that's at. So speaking of the private well class, it's 10 lessons, it's self-paced. So you sign up on our website and it sends you one lesson a week through email. It's a PDF, and it walks through how water flows through the ground, the hydrologic cycle, to how wells get contaminated, to best practices, to well components, all the way through treatment, why you should sample, and things to avoid and pitfalls, and what to understand about if you're going to add treatment to your water, and what's necessary. So it's the answer to what can I do to help private well owners understand their wells and their water. So we do a lot of other things, videos, podcasts, webinars. I'm going to go through some of that. This is our website though. It's front page. It's just privatewellclass.org. When you click on the button that says take our free class, and I'll get back to the help center in a minute, it takes you to a page like this, or it will, except for today, because we're moving our website to a new platform. And so normally you'd sign up, or you have people sign up, just their email address, first name, and where they live as a drop down for what state they're in. And that's really so that we can show the US EPA that this is a national program. We are helping people all over the country and in the territories, and all that stuff. But the email address, obviously, we would need to send you the lessons to a well owner. And so what we ask for, professionals is, if you have a website, it's pretty easy to put a link to us on your page. EPA's private well page has a link to us too. I mean, they fund us. It's all free. We don't sell anything. We're part of a quasi-state agency in the University of Illinois. So it's actually, we operate much like a nonprofit that's providing services. And it's actually a really good place to be in for us. So this is what that page looks like today though. It says class enrollment is temporarily unavailable while we upgrade our systems. And so we're holding people off because it's ran like a marketing campaign. Each week it sends a lesson. So you sign up at 5 o'clock on a Friday, you'll get a lesson. The next Friday at 5, the next Friday at 5, all 10 lessons. And so the software we use for that, we're changing to a different software. And we don't want people to be partway through the 10 lessons and then move them over. That's a lot more work than just asking people to wait for a few weeks while we get this done. It's available in Spanish. The entire site has been, all of the lessons And some of the videos that are the short videos I'll mention in a second have been translated to Spanish. Being at a university like the University of Illinois that, you know, has a lot of, you know, world-class research and all that stuff, is we have a really good civil engineering department, and a lot of students from other countries, including a young man who did all of this work for us who was from Colombia. Yeah, it's pretty amazing what he was able to accomplish. So, I mean, everything, even all the figures we've translated into Spanish. So it's all available if you're in an area where you have a fairly decent native Spanish speaking population on wells. This is something you can share with them. For each of the 10 lessons, there's a set of resources we provide. Like the first lesson is called The Science of Groundwater, and all of these other documents support that. You know, Iowa's Groundwater Basics is a pretty good document. The two by Lau Raymond were done in late 80s, early 90s, but they're great. They're really simple diagrams, easy to understand, well written to understand. And the idea behind this is the private well class was actually written to be kind of almost conversational. And for some people that really resonates, and for some people it doesn't. And so these other resources will help reinforce the material in the lessons. Each one's about 6 to 10 pages. So it's not like, you know, you're gonna get a textbook for each of the 10 lessons. There's about 80 pages total, I think, for the 10 lessons. And it's, you know, for every person that says, hey, I want these quicker than a week at a time, I'd rather just go right through them. We have another person that says, you know, a week's almost too fast. I don't always have time to do this. So we've kept it where it's been since we started in 2013, just because that's kind of the feedback we get. Going back to this, when you enroll in class, at the very bottom here, it says, are you an environmental health professional? If so, click here for more information. Well, if you are a NEHA member, you know that their e-learning center has went through a number of changes since, you know, say 2018. And so we actually just updated some stuff today because as part of our partnership with them, they offer all 10 lessons in their e-learning environment. And as a environmental health professional, you can do each of the 10 lessons for free and get a CEU of credit or CE of credit for each one. And you don't have to be a member. You just have to register on their My NEHA site for the e-learning stuff. You have to have an account to get in, and but it's free and you're not required to be a member to take it. But when you click on that button, it takes you to this page. We've circumvented this. This isn't, we had to get here, but this is open to anyone, so we were able to get right to this. So it says, you know, it's free. You have to add it to the cart. You have to actually go in and quote purchase it first. And once you start going through the screens, there's 2 or 3 buttons here, and then you get to one where it says you need to sign in. And if you aren't a member and don't have a sign in, at the very bottom that says need an account, sign up, and then it takes you to this page where you'll do that, and then you can go back and get into your class. So it's available to anyone. So all of our webinars like today are recorded and they go on our YouTube page. And they're also, you can get to them from our webinars, past webinars page too. But we've done a few on special topics as well. Like this is, you know, this one's from last year. Is my water safe to drink? I know, like, we had a number of construction questions. We also had a number of questions that we just answered last month on our webinar, which, you know, what I encourage everyone to do is if you want to learn more about all the things we cover related to sampling and what we recommend you test for, well construction, all those things, go to our YouTube page and look at all the videos. Like this one is my water safe to drink. We offer that probably at least 3 times a year. So it's the same content or close to it for the first hour and a half. Yeah, and then the last half hour is all questions that we answer that are different every month. I mean, so it depends on who asks what, right? And so, but going through those questions on all the webinars is really a good way to learn things about what people are interested in or what people have concerns about. and we cover a lot of material. Like I know today, I'm not covering this, but Minnesota Department of Health has this document called Home Water Treatment. It's the best document I've ever found that explains water treatment and all the different types and how they work and what they cost and what kind of things they can take out of the water. It's a document everyone who's a homeowner and is going to look at treatment needs to look at first, because it really explains a lot of good information. Yeah, so funding and financing. The last time we did this was in February of 23. We had USDA on. They have a program, again, for low income folks. The truth is there's just not a lot of funding and financing available for well construction or rehabilitation or that sort of thing. And so, but we get a lot of calls from folks who, on a fixed income and their well's not working. And that's another place where RCAP can come in. And, a lot of these people can't tell me any basic information to even know if a breaker got tripped, and that's all that's wrong, versus, they really have a well problem. And so we try to help find someone locally who can at least go and take a look, and or an RCAP person and from that state who can talk to those folks and try to find out more information. Lead, after Flint happened, big topic, and the thing everyone needs to realize is that every home's at risk for lead if it's before 1984, if it's got copper or any kind of metal pipe, just because solder until 2014 had at least 5% lead in it. But 1984 is when we stopped using lead in Illinois. We were one of the last states to stop using lead. But if you have an older home, it's good to know if you have lead, and it isn't a city problem. All the work that's being done now, you hear about lead service line replacement. That's from the water main to the junction where it meets with the lines going in a house. And it doesn't mean you've got your lead free even after replacing the lead service line, because they could have lead in their home, in their pipes, and that's every home. And so we had a guest speaker from Virginia Tech on, Dr. Kelsey Piper. She's done a lot of research looking at lead in homes and private wells. And what it really comes down to is, communities do corrosion control. They use phosphates and other things so that the water is not corrosive and so that it doesn't leach lead. Because there's towns that have lead pipes where they have no lead in their drinking water. It doesn't automatically come off the pipe into the water. It has to be, the chemistry has to be right for that to happen. And so it's good just to go through what she's provided and all the research she's done there. And so we set up a page too. It's just privatewellclass.org/lead. And we've got links to, like the filters that work for lead are pretty common. Most companies now that make like the faucet filters or the pitcher filters, they're set up to remove lead. And they've been verified through a third-party certifier. So we found a way, right? And the same will happen eventually with PFAS. I know that was asked by a couple of people. Then we also have these short videos. We call them training videos, but they're 4 to 6 minutes at most, and they're on one specific topic. Like, there's a lot of people who share a well. And in many cases, there's no agreement. There's no anything in the deed. There's nothing written down. And what I see is that the best way for two neighbors who may have been friends for many years to all of a sudden not be friends when a pump fails and it's going to cost $4,000 or $6,000 to replace it, and one doesn't want to put in their half or whatever. And so it's actually a much bigger issue than most people realize. And we also had contractors trying to skirt the law that says more than 15 homes or 25 people is considered a public water supply. So they put these subdivisions out in the country, and there's one well for every 5 houses. So they're not a public water supply, but now you have 5 people sharing a well. Terrible. But anyway, so there's 16, or there's probably 20 of these now. This is an older slide. But what to do after a fire, what to do after a flood, what is a bedrock aquifer or bedrock well? Just one question, and it's answered that way. And actually, I'm going to talk about the Help Center in a second. Every one of these is also, you can find it in our Help Center, which is really cool. We just launched this April 1st. We do podcasts. We have this podcast called Tap Talk. It's meant to be about drinking water in rural America. So we have folks on both the private well side and the community water side. These four are all folks who talked about private wells. Eric Egges works at the Water Quality Association. They certify treatment devices. Brian Swistock was retired now, was with Extension in Pennsylvania. Most people revere him as really the father of private well knowledge, and I mean that. He knows more about private wells than anyone I've ever met. So it was great that we got him on early on before he left. So I mean, they're really interesting. They're talking about real issues related to private wells, and so I encourage you to check that out. It's just drinkingwaterpodcast.org. I should have that on here, and I don't. You can get to it from our webpage. So, in the end, and what did I do with the helpline stuff? The goal of our class is to help well owners understand why their well is important and why they need to know how it works so that they can ask better questions, and so they can also protect themselves from any risks that you might have from drinking water. It's very doable. You just have to take it seriously and understand your specific situation. You know, wells are very different, almost everyone. There's something different about every home we go to, either the way it's drilled, the type of aquifer it's in, the type of pipes they have in the house, whatever treatment they may have, what they're storing near their well. Something is always different. They're very unique. And so you see a lot of crazy stuff. That's why I'm not there yet. So that would be the basic stuff for everyone. But then we also have, our program with NEHA that's really geared just towards environmental health professionals. And again, each of the lessons is on NEHA's e-learning center, and it's not only for sanitarians or environmental health professionals, but also for home inspectors. They reached out to us, they already had a relationship with NEHA, and so now they can all get on there and do that too. We developed this assessment tool to evaluate risk. I mentioned that earlier. And it says we do have a guide, and the tablet version, that was a great thing 4 or 5 years ago. We used like an Android tablet, so you could use it in the field. Today, we've stopped supporting that app because PDF stuff on your phone has come far enough along that now you can really use a fillable PDF on your phone and nothing else to complete this assessment. So, and we do have a partner page, and our newsletter is really for our partners. You can sign up. This is the partner resources page under the resource library. It's really just to sign up to get our newsletter once a month, or once in a while we'll send out a separate email about like these brochures that we developed that we give out for free. If anybody wants any of those, you can contact us, and we may send an email about that. But that's there. There's the brochure I mentioned. There's some other resources down at the bottom as you scroll down that page. We do put out a newsletter every month. In April was our 100th one. So this is a well sealing demonstration of an old dug well. It's actually near downtown Macomb, Illinois. So somebody bought this house 4 blocks from the town square. Macomb's a town of about, I think, 20,000 or so. But they had this concrete pad right outside their back door, and it had a little 3-inch hole in it, which had been for a hand pump. But there was nothing there. So the geology department is also part of Groundwater Guardians group. So they do philanthropy and stuff to teach people about wells and groundwater. And the person who bought the house contacted them, and in the end, we made a video. This driller who you're seeing the bottom half of here volunteered all the bentonite and his time, brought a skid loader, and we invited county health department folks from, I don't know, probably about 10 or 12 counties to come and hang out while this well got abandoned properly. And so it's pretty cool at the time. And it really talks to, how you fill this in and why you need to have layers of bentonite, which is, seals it off and things like that. Just another one of our newsletters from a couple of years ago. And then I mentioned this assessment. It's a fillable PDF. What we did, we facilitated all this. So I was part of the work group, but we also brought in, I want to say 10 other people, 10 or 12, but we had a couple drillers, we had a couple people from Extension, we had a county health, 2 county health department people, 1 state regulator, and a couple hydrologists. And so together we put this tool together, and we spent, we met several times and passed versions back and forth. And it's really comprehensive. And so, RCAP's actually done nearly 4,000 of these assessments now, and they've added, not only will they do this for a well owner for free, and it's, hand it back to them, and, here's what we're concerned about. At the end, there's a place to talk about what they could do better or best practices. So it recommends they sample and they take the private well class, but it also talks about if they have any issues, but now they also include a free water sample with that. So if a homeowner's having an issue, they can contact their RCAP region or contact us, and we'll get you in touch with them. And then they'll go out and do an assessment and get a water sample, and they pay for it all. So it's a really cool program for outreach and education, in that, it's not just sitting here and providing lip service. We've certainly helped a lot of well owners through this program. So, and I know I forgot to add into this slide deck today, and I apologize, but we also created a tool just like that just this last year. Oh no, it's in here, I think, for septic systems and for on-site wastewater. So the well assessment, though, it's like a sanitary survey for a private well. If you're a health department that actually does those for community water supplies, gives us a chance to meet with a well owner one-on-one and talk to them about their specific situation. As I mentioned, every well is really a little different. Promote best practices, and also it gives us a chance just to, some people don't want to share information, or they're concerned about, like, I get a lot of well owners who say, well, I didn't go to my health department because I'm afraid they're going to tell me I can't drink my water. There's 1 or 2 local health districts. I know there's one in Connecticut that actually have the authority to condemn a well, but almost everywhere else, 99.9% of all the jurisdictions that you would go to that's a health district do not have that authority, and instead they're there to help you. And that's what I try to tell well owners is, you need to contact your local health district or your county health department. They want to make sure you're safe. They'll work with you. That's, they care, all that stuff. So we try to include that communication whenever we're doing those things. We did develop a guide. Like I said, you really have to know a lot about all aspects of a private well and a home to be able to fill all of it out well, including things like, we asked if they have backflow prevention on their outside spigots, or if they have a barn, or where they're mixing chemicals or whatever. And I don't know very much about backflow devices, except when I put this together, I learned a lot. And so it's on our webpage too, but it walks through all the different sections. And so I put one page up here that's at the very beginning. What we recommend people do in advance, you can look up and see if there's a well log. In some states, you're going to find it online. Some states it's not available, or it's at the county or local health district. And then at the end, the last section of that is recommendations and suggestions, just things to remember. You're handing them this document. And so take pictures. We tell them to take pictures. Make sure anything you found from a search of records, like their well log, you're including, and you're giving them this nice packet that it's kind of sealed with a bow, if you will. So I did include it, and so we worked with NAWA, the National On-Site Wastewater Recycling Association, and RCAP has a lot of very talented wastewater either licensed operators or folks that are experts in on-site treatment, as well as Sally helped a lot too. She's our expert here, and last year we developed this septic assessment tool, and so or on-site wastewater treatment system assessment tool. It's set up just like the other one. They complement each other. Our original grant deliverable was to create something that could be inserted but instead it ended up growing into its own document. And so now RCAP are out testing this. We know that anytime you develop a tool like this, once you use it in the field, there's going to be folks who are like, oh, this would have been better if you did this, or this was missing, or I'm not sure. I never answer that question. And so they're doing 140 assessments now, which by the end of, I think, the middle of 25 or so, they're supposed to be done with those. And then we're going to reassess and update it. And then, I mean, it's available today if anybody wants to download it and use it, but it will get modified eventually. And so, again, the goal was to create a comprehensive tool for someone who has some wherewithal and understands wastewater, on-site wastewater systems. And so that you could also use this as a tool to educate that homeowner about what risks they may have or things that might be a concern. We put on a conference in 2017 here in Champaign. It was 3 days. We had 26 talks. It wasn't a research conference. We didn't bring in a bunch of professors who were talking about, the research they're doing with private wells. We had a couple of professors who were talking about projects they did where they actually sampled homes on private wells, but most were other types of folks. I know whenever we run across someone who has a novel program, for instance, there's a county in Oregon where the county health department wrote and got a small grant to put some lab equipment in 2 of their high schools. And so they could do basic testing for coliform nitrate. And then they had the science classes and the journalism classes and those clubs and teachers do all their private well samples. And so the kids got experience using the equipment. They wrote the responses back to the homeowners, and that's now how they run their samples through these 2 high schools. And I thought it was such a cool idea, and I think the grant was only for like $12,000. And so we had her come out and give a talk on that, trying to share information that help all of us, where there's novel ideas or new things to share. And so the other thing we did, though, is, a lot of, especially local health departments don't have a travel budget. So a lot of folks couldn't come to our conference in person. And in fact, we paid her way because we wrote that into our grant so that we could, if we wanted someone to come and who couldn't make it. And so we recorded all these. We actually had a person we hired who was in the back. It was all tied into the sound. And so every one of our presentations from all 4 conferences are available on our YouTube channel. So if you're interested in things like Nebraska did a grout study, looking at different types of grout and different geologies. We had Tom Christofferson come and talk from Nebraska DHHS about that study and what they found, and we really are, what he said is, we really thought states would change their well construction code after that study, and no one has but Nebraska. And so there's some types of grout that don't really work in some geologies, and that's a problem, obviously. And so we had Barb. I mentioned Barb Luukkonen before. The study they did, that's her ironing some $2 bills to put it in their surveys they sent out. We did our 2019 conference in Pennsylvania, which is a state that doesn't have well construction code. And so Todd Giddings was our first speaker. They create a local private well ordinance that requires you to have a certificate from the National Groundwater Association as a master driller to drill in their area. And so we thought that was very appropriate, dealing with that situation. And so we had that one in state capital Pennsylvania. Then we've done 2 online, obviously because of the pandemic. Dr. Murray talked about a study she did working with local clinics, pediatricians at 11 local clinics in New Hampshire. And she gave them test kits and had the front office staff and the nurses and doctors each give test kits to patients, and then observe what happened as far as how many people return the kits. And these are all patients of pediatricians, so on private wells. So families with kids, right? And it was really interesting because if the nurse or the doctor gave the person the kit, they were like 3 times more likely to return it and get the results and all that stuff than if it was somebody else. And so that really led us down a road of trying to get into places where we could talk to clinicians. And we've been fairly successful at that too, because, my opinion is every person should be asked by their doctor where they get their water from. And if it's on a private well, then they need to understand that they need to sample and understand what they're drinking. So, anyway. So we've had 4/22/01. I mentioned this brochure. So we developed this trifold brochure. We actually get it printed by at a printing place. It's already folded. They're bundled into 50, and we offer it free to anyone who wants it. So we started this probably 5 years ago or so. And the idea we came up with, and it wasn't mine, but it was one of my staff, was like, every health department has a waiting area. We should just have these sitting in their front area or whatever. And so we've offered these for free 5 different times. We've actually had to print them 5 different times. This is the back or the inside when it's folded. It's also available in Spanish. And this yellow box is there because we encourage folks to put their own label there, so that people have a local person to contact if you're interested in those things. And the information from your health department, or, I know one of the state labs asked for 2,000 of these so they could put them in all the sample results they send back to people when they have their private well tested. It is available in Spanish, as I mentioned, but we've, and this is an older slide, but it's just, in our newsletter, we've asked several times, would you like to have any of these in English or Spanish? We've now printed over 90,000. I think we've printed 96,000, and we've given out 90,000 or close to it, to over 500 different organizations. So yeah, that's been very successful. And the last thing I want to talk about before we get to the questions is our hotline. So we developed a private well hotline, national hotline, that it's not there yet, but it will be within the next few weeks on EPA's private well webpage. So when a homeowner goes to EPA's website to look at their private well information, they can find our class, and now they'll be able to get to our help center, which it's 3 things. And this is the front page at the bottom here. It says visit our help center. When you go to that, you can ask a question through chat, which is the little thing in the bottom, on the bottom right, that pops up. You can type in into the search, the knowledge base thing. You can ask a question, and if you put, is iron a concern in my water, on either one of those, it's going to give you an answer or take you to an article that is an answer to a related or the exact question. Or you can call us, and there's a phone number there. And it hasn't launched on EPA's webpage. The only place we've really advertised it is on our social media, and it's on our front page and through our newsletter. And I believe we had over 900 people in April come to the site and ask a question, and looked at over 1,000 articles. So it's there, it's available. It's pretty cool. And what we did is we took all of the transcripts from all the webinars. We've answered all these questions and have a pretty consistent message. And we put all that into this knowledge base, and then the AI that's part of this chat bot searches through all that and comes up with a composite answer. And it does a pretty darn good job. Excuse me. So yeah, check it out. If you have any comments, we're always welcome to those for sure. So getting to the questions, as I mentioned at the beginning, Katie's monitoring the chat or the question box on the GoToWebinar window. So if you have a question, you can put it in there, and we'll pull those up at the end. But we're going to answer some of the questions that you all put in when you were given a chance to ask a question when you registered. And the first one is really for Sally, because she's an RHS, and she had a good story to tell. So take it away.
Hi, so I'm Sally. So the questions was, do you have any tips for the REHS exam? And I took the exam back in 2017, and I was very nervous. I had a completely different life, kind of stumbled upon being a health inspector, and kind of had to learn everything as I was actually doing inspections. So it was very daunting whenever I first got started. And so I was really nervous to take the exam. And so, as Steve put here, the thing that got me to pass was being married to a driller geologist. For the particular test I took, it had so many geology and OSHA questions, and I had not studied any of that type of question. So I was really glad that I had actually listened to my husband over the years, because that's part of what helped me get past the test. But my suggestions are study, study, study. I got up early every morning for about 3 months, and I just went through that NEHA study guide front and back over and over until I knew, as much as I thought that I could before I went and took the training. One big tip that I have is to ask others who have already taken the test. So, for me, I always tell people, the book didn't go over geology and OSHA, so you might want to get some more information on that, where other people, they didn't have as much food experience, and so they may tell you, here's the types of questions that I had about food. So find people that can help you with those questions that you're not as strong in. So for instance, I didn't have any swimming pool inspection experience here in Illinois. That's all done by the Illinois Department of Public Health, not your local health departments. So I had to reach out to other people who did have swimming pool experience to help understand the different formulas and stuff that would really need to be known. And the one question that I think has been on the tests since at least the 90s is, can a septic system actually float? And it is true. So you can get at least one question right on the test. So good luck to you. And it is an extremely difficult test. So if you don't pass it the first time, don't worry, just keep trying and use that feedback that you get on those previous exams to help you study those areas that you need to work on a little bit more. Okay, Steve, back to you.
Thanks. Sounds like a fun test. Yeah. So well maintenance. So there were two questions, and Sally put this together too. Is there a checklist procedure for private wells? What type of maintenance should I do to get the longest life out of my well? Well, the first thing is, of course, to sign up for our class, the private well class. We go over a lot of that stuff in a lot more detail, more than we can certainly do today. And so I think once you go through those materials, you're going to see, it actually has that advice in it. And so our Help Center also has that same, some of that same material. And so Sally had this article. Don't worry about the URL. Just go. You can just go and say, how do I maintain my water well? Up at the top on that green page I showed you a minute ago. And this goes on down the page. But this was an article that's in there. Sally put together. And there's some references at the bottom to other sources like the National Groundwater Association and CDC, I think. And so it's meant to be, pretty helpful in all that respect. So the other one, any changes in water tables in the lower 48? So the scientist in me, I wanted to address the fact that, a water table is the first, as you're digging down into the ground, it's the spot where the soil is completely saturated. There's no more air. That is not an aquifer. It could be completely clay. So you couldn't put a well in it and get it to pump very much. It would go dry really fast. So aquifers is not the water table per se. It can be, in an area like along a large river where you're down in the bottoms along some like the Mississippi or Illinois River. All that sand is also an aquifer, but it's also the water table. When you hit water it's in the aquifer comes all the way to the surface in that respect. So understanding there's a big difference, and water tables fluctuate with the weather, and in most places. If we have a dry summer, the water table in Champaign County may go from 8 foot down to 12 foot. But over winter, we have snow, or we have a wet year, it could get shallower, and it's different in different parts of the landscape. So it's not the same as an aquifer, and how water levels will change based on pumping. We have an area, a deep sandstone aquifer in the Chicago area that's been overused for many, many years. And because of that, the water levels have dropped in some of those wells over 1,000 feet. I mean, the aquifer's at 1,600, I think, somewhere around there. And so it's enough of a problem that one of the larger communities up there, Joliet, Illinois, has formed a consortium and a water district, and it's a $750 billion project for them to go off of their deep sandstone wells and run a pipeline to the Lake Michigan and go on surface water. So I just wanted to point out that an aquifer is very different. Like I showed, there's 3 different aquifers where I'm at in Champaign County, Illinois. And so each of those has its own water level. We do teach a class called Groundwater and Wells. I can't remember the last time we did. It was probably at least 4 or 5 months ago. But we talk all about how water levels can change, what an artesian aquifer is, how pumpage affects wells, all those sorts of things. So that's really a good place to start to understand. The other thing I really want to talk about is most states, or like the USGS or others, collect water level data. I actually installed, installed probably 70 or 80 monitoring wells around the state that we still measure for water levels since that we put in the 90s. We have all that data, and we continue to collect water level data to understand long-term what happens to an aquifer. And it really varies based on whether it's near the surface and gets surface infiltration quickly, or whether it's more buried and it takes a long time for water to get there, all that sort of stuff. So Sally found this when she was looking at this question, and this is a USGS publication from Nebraska about the Ogallala, and now it's called the High Plains Aquifer. It runs down to Texas. 96,000 irrigation systems in Nebraska, really heavily irrigated. And you can see they've collected data since 1950, I think. There's a URL down there at the bottom, but you can also just Google High Plains Water Level Monitoring Study, and it's going to come up, I'm pretty sure. But everywhere, no matter where you live in the US, there's going to be data available about water levels and at least the major aquifers in your state or area. That's what we do here in Illinois. So going back to this example of the Mahomet Aquifer, it runs basically like a belt through the center of Illinois. It doesn't go all the way across, but it goes from the Indiana state line to about 2/3 of the way west across the state. It serves, I think, 13 counties with water. It's just very thick, wide bedrock valley full of sand and gravel. And so it's a huge resource. And so we have wells throughout. I've put in, the wells I put in the 90s were all in the Mahomet. And in Champaign County, we have a well called Petro North. It was named in the 50s before my time, but Champaign-Urbana, where the University of Illinois is, has grown obviously over time. So in 1953, our water company pumped about 6 to 7 million gallons a day. And now, as of 2013 or so, it's up to 22 million gallons a day. And so you can see that's the red line. I think that's red or orange. I'm colorblind, sorry. And then the other line, the blue one, are water levels for a monitoring well we have just outside of town. And you can see how there's a lot of fluctuation in summer, winter, that sort of thing. And it's near some pumping wells that have impacts to the water levels in that well. not significant, but over time, because Champaign-Urbana is pumping more water, water levels have, both water levels and the pumpage have flattened in the last 15 or 20 years, and so has those graphs. So when you get to about 2003, you can see it's basically pretty flat. There's variation, obviously, depending on the season, but it's more of a straight line off the right side of the graph than, you know, sloping down like it was before, and that's because the pumpage in Champaign for water is leveled off. So there's a huge relationship there. The more pumpage you have, the more drawdown you have, and over time, like I mentioned, the Chicago area, they've lowered those water levels 1,000 feet instead of the, you know, the 40 or 50 feet we have here. If all the pumpage stopped, it would take a while, but eventually water levels would go back probably up around the 650 or 660 range, like it was before there was any people here. So, you know, it's mass balance, what you take out versus what you put in. And as we take more out, you know, the water levels are going to drop. We also have, for our monitoring wells, most of them now have telemetry, which is a pressure transducer and a little phone. And so I use this image because I like the look of it, basically. It's from last year, but if you went on our website today under our monitoring wells and under the groundwater science page, you could see what the water level was in this well was an hour ago. If they have it set, sometimes we have it set to an hour most of the time, sometimes they have it for half a day or a day, depending on how dynamic the system is. But we have you know, we know since we put the telemetry in, which looks like around 2019, we know what's going on, what happens every year. Up by Rantoul, there's a lot of irrigation. So you can see in July of 19 and July of 20, they were dry years and there was more irrigation, so water levels dropped. As soon as those pumps turn off in the fall, water levels come back. So it's, and my point in showing these is that there's probably data like this available from near you, wherever you're at, either from the USGS or one of your state agencies. So PFAS. So I actually pulled these two slides. There's another slide after this one from last month, and which is another reason why I encourage people to go back, and if you are new to our program, go back and look at the old webinars and see what questions we've asked, because if it wasn't, you know, there were several questions about PFAS, so I decided to go ahead and put it in here, but I try not to answer the same questions every month because you can always go back and look at the other ones if you're interested. But yeah, I left it in here mainly to make that point, I think. So the thing about PFAS is that, you know, we're still learning, science is still learning about what they are, how they actually operate, what health problems they cause. You know, initially they said there was about 200 of them. I think now we're up to over 1,300 different PFAS compounds, something like that. And they're in everything. I guarantee you they're in your body. They're in our clothes, they're in our kitchen, they're in the air. It's been used so much on so many things that, you know, we're going to be dealing with this for, you know, way more than the next 20 years. And because they're so different in some cases, they don't act the same. They have different health effects. They break down differently, and, you know, they're still learning. I mean, the EPA is doing all this work, and I think they, you know, the PFAS rule that just came out was, I believe, just for 6 PFAS compounds, the most common ones, which is good. But there's just a ton of work going into this, and there will be for a long time. That it's going to be an evolving thing, and so it's certainly something to be concerned about. I don't think we really understand how it's affected us long term since they started using these, I think, in the 40s. But it's certainly a concern enough that you want to not have it in your water. It's fairly expensive to test for right now. And what I tell well owners is, if you're near one of the potential sources, like you're near an airport or, you know, a fire training institute, or, you know, whatever it might be, or, you know, a company that uses that makes some of those things that have PFAS in them. It hasn't really been shown yet that a typical rural home that, you know, doesn't have any sources nearby is likely to have elevated PFAS in their water. Doesn't mean it's not the case, and that's a personal decision if you want to sample for it in that respect. But the only, well, I talked to a researcher who's doing a lot of PFAS work around the country with private wells, and she said, you know, the source for a local home is likely to be your septic system or your on-site wastewater system. So the advice I would have there is understanding how your well relates to your on-site wastewater system, your septic system. I mean, if you're here in Champaign County, for instance, the aquifer doesn't even start. There's clay for 150 feet. And so nothing from the surface is going to make its way down into the aquifer here. It recharges in other areas mostly. But if you're in a county that's much lower in elevation along a river, it's sandier soil, it's pretty hard not to have surface water effects in those aquifers. And we see, you know, we've done a number of studies looking at different ag chemicals and other things, especially back in the 90s. There was a lot of that work done. And, you know, the Duggan Board wells and the shallower wells that are in shallower aquifers typically had more problems than those that are from deeper wells that are, you know, that have protection, if you will, from clay at the surface. But the good thing is they can be treated for, I guess I already said all that. So the activated carbon, ion exchange, and all this comes from EPA's website. RO actually works. And so they have two sources. Science Matters is a publication they put out. It's an email publication that comes out, I think, every other week or so. But there's, if you email us, we can give you these. I don't think I gave them to Katie in advance to put in the chat. But they also have this thing called the treatability database. And that allows you to look up a contaminant like PFAS or, you know, PFOA or whatever it might be, or arsenic or, you know, lead, whatever, and it'll tell you how to treat it. And so it's pretty handy in that respect. So yeah, and some of these filters, you know, even you know, like the carbon filters that, I don't want to give a brand name, but the ones that go on your kitchen tap, that, you know, they have carbon in them and sometimes some other things. They're really good at removing lead, and some of them actually do a really good job of removing PFAS. And I don't know enough about that to know like which ones or whatever, but now that there's a rule for public water supplies, I'm sure some of those companies are going to be providing, you know, they get them tested by a third-party certifier to ensure they actually remove what they're supposed to. And if they've been certified by either Underwriters Lab, the National Sanitation Foundation, or the Water Quality Association, that gives you some confidence that if you buy that particular device, it's going to remove whatever it said it would. And so that's what we tell people to do. Make sure it's got one of those 3 seals on it from those third-party certifiers before you buy any kind of treatment for anything, really. Regulations. Yeah, no one's ever asked about private well regulations, so I appreciate that, because it's, you know, there's a lot of stuff done. There's a few things going on, but are there any plans for regulating private wells? And I'm going to assume you mean just about the water quality in a well, or the water from a well, because wells are regulated in every state but 2 for construction, and you have your licensed driller and all those things. But there's 4 states that require testing at property transfer. The first one was New Jersey, but I know Connecticut and Rhode Island, and I want to say Oregon, or I can't remember if it's Oregon or Arizona. I think there's 4, but Rhode Island, so the other 3 at property transfer, you have to get it tested for whatever the rule says. And Rhode Island went one step further. They tied it to their building inspectors and gave them some authority under that, so that if you test the water, and say you're selling your home or you're buying a home, they require you to test the water. If it turns out it's above an MCL, maximum contaminant level that's required under the Safe Drinking Water Act, you have to remediate it. You have to put treatment in, or they can actually, in the worst case, they have the authority to condemn the building as unlivable. And I don't know if I mentioned already, but MCLs mentioned at the top there, maximum contaminant levels, are set by the Safe Drinking Water Act. And the EPA, just like the new PFAS rules, then every public water supply in the country has to meet those, every community water supply and non-transient, non-community supplies. So private wells aren't regulated at all based on water quality. And I don't know of any jurisdiction even locally that does that. And as far as my view of the world, I really don't believe there ever will be a national testing requirement for private wells. It just, there's, like in Illinois, it's very farm centered. Our Farm Bureau has a lot of political clout. Farmers want to be left alone. They can take care of they think they can take care of themselves. There'd never be the political will in Illinois to pass a law like that. And I just don't see that happening nationally either. So yeah, that's my opinion. There was talk of making a national regulation based on what New Jersey's done at property sale. And, that actually went to committee a couple times, probably 10 or 15 years ago, and in our federal legislature, but it never got anywhere. So, and I don't know why. I never followed that closely. I try to stay out of politics, but yeah, I know that happened. So, groundwater versus surface water. Difference in risk with surface versus groundwater and influence on shallow wells. And it wasn't worded quite like that, but they mentioned shallow wells being groundwater, but also influenced by surface water. So just remember that groundwater was once surface water. It's all part of the hydrologic cycle. So it may, when it rains really hard, some of it runs right into a river, the whole cycle ends up evaporating, blah, blah, blah. Some of it runs into the ground and infiltrates. And that can be a few hours to thousands of years, depending on the particular flow path. And that's just a fact. You have water that's been dated, and it's not that deep, 50,000 years old based on some of the constituents in it. And so it's the cycle for that particular water is, more than 50,000 years, but eventually it's going to come back to the surface. Because it's a system. You put water in on one end, it has to go out the other end because of the pressure you've added by putting water on one end, right? And it all runs, water wants to run downhill based on pressure. It wants to be flat, and it can't be. So like when you pump a well, the reason more water runs into the well is because now you've lowered the water level at the well and near the well. So all the water in the aquifer around it is trying to fill it back in to be flat again like it is in your bathtub. And it can't because you keep taking more out. So water runs to the well, and that's how that works. Shallow wells, though, certainly can be influenced by surface water. And in fact, for a community well, there's a thing called groundwater or under the influence. It's groundwater under the influence of surface water. And it's a special class of well. It's not considered just groundwater. And they actually have to treat it like it's surface water, and which is really about pathogens, 5-log removal of viruses and bacteria. There's such an acute risk from drinking surface water because of pathogens. It's definitely more of a risk, and it has to be treated a lot more to be served like in a public water supply, right, to like a community that uses surface water. So, but the other thing to remember then on the other hand is you can have arsenic, uranium, beryllium. All these things are metals or constituents that are a natural part of our geology, and in the right conditions, they can be pretty high in your well water. We have wells here in Illinois that have arsenic at over 250 parts per billion when the standard is 10. So yeah, but I'd say in general, it's less of a risk to use groundwater. Most of those things like arsenic, the standard set based on your long-term exposure over time of drinking it every day versus, you get a pathogen and you're going to get sick from it, right? What for and when should we test our well water? Again, we cover this in the last webinar, and I showed you the webinars page. It's got the upcoming webinars, including today's, and then below it's got the past ones. Last month, we talked about, I mean, there's 6 or 7 slides that cover this question, and not just what to test for, but what to do with your results and all those sorts of things that I'm not going to go through today. All I'm going to do is show 2 slides. This is what we recommend people test, and I want to caveat this by saying we recommended a set of constituents based on a national audience, knowing that it's variable in different parts of the country. You know, we don't recommend uranium here, but if you're in Massachusetts and you have a bedrock well, you're probably going to sample for uranium. And I say that because the bottom bullet's the most important one. Get advice from your local or state health department on what you should test for. If like Tazewell County, Illinois, that's where all the arsenic is. If you call Tazewell County Health Department, they're going to say, well, make sure you test for arsenic because we have a fair amount of it in our aquifer in our county. And I say that because of things like this. This is Rhode Island. All the little dots are where there used to be orchards, and they used arsenic as a pesticide for many, many years. And now the soil in some places, the groundwater has high arsenic because of that. That splotch in the middle third is natural occurring beryllium. Until I found this on their webpage, which has probably been close to 10 years ago now, I didn't even realize beryllium was a regulated contaminant. I've never seen it in drinking water in Illinois or nearby. But it actually occurs at pretty high levels in Rhode Island. And so that's why you need to ask and not just go from a list that somebody gives you. You need to find out and be inquisitive. That's what we tell well owners, you know what your water quality is and know what could be a source. So yeah, it's that list. And again, if you go to the April webinar, you'll see some more information. But yeah. Oh, I left this in. This is the last slide. My bad. This was from the last time we did this presentation. So that's quickly. I'm going to go to any questions we may have. And it looks like we just have 2. So I'm going to pull this over. And Katie, can you see that okay?
Yep, it looks great.
Thanks. Okay. Is that where drillers use explosions to fracture rock to increase flow? Yeah, so, or fracking, right? You can use pressure. And the thing about fracking, you hear that and everybody gets scared, but fracking to increase water production has been going on since the 50s, as far as that goes. But yeah, you can fracture the rock, and in theory, you're opening up connections among other fractures that aren't connected. And yeah, so yep, that's common practice when you need to try to do that. So this next question is very local. It's about the Mahomet, and Leroy is a town that's between here and Bloomington, about 30 miles away from us. And the question is, does the Mahomet Aquifer go under Leroy, or does it stop outside 8 to 10 miles like some engineers think? Well, we have a pretty good idea of where the Mahomet is based on well logs and the geology, but offhand, I can't tell you. Without looking, I believe it's south of Leroy, but I'm not 100% sure of that. So if you want to give me a call, in Illinois, my job is to help well owners in small communities and folks who have some of these issues. I'd be glad to provide you with more information, and so would our groundwater staff. But yeah, just email us, or you can email me directly. You can find me in our directory, U of I directory, Steve Wilson, State Water Survey. I'd be glad to look that over. I do believe it's south of town, but I'd have to look. Yeah, that's 8 miles is a long way to put pipe in for a water supply. Yeah, anyway. Okay. Well, thank you for everybody who attended. And I guess I don't have, oh yeah, I need to show this bottom part here. Again, if you're looking for CEs, you can email us. And if you have any other questions, you can also email us here. Katie monitors this email address, and like the person from Leroy area, if you'll email us there, she will get that to me, and then we can talk. So, okay. Thank you much. Everyone have a great day.